Hello everyone, welcome back to Mom's Precious. I'm Snehal, mother of two, trying my best to help you. In today's video, I'll be talking about hand, foot and mouth disease, also known as HFMD. It is usually found in young children and infants. So we'll be covering the symptoms, causes, diagnosis, treatment and prevention of HFMD. So let's get started. Parents might mistake it for chickenpox. HFMD is a mild, contagious viral infection common in young children which heals on its own. The child will develop fever along with some red boils on the hands, legs, around the mouth area and even inside the throat. HFMD is caused by a virus named Coxsackie virus A16. HFMD usually happens when your child comes in direct contact with other kids' mucus, saliva, and unclean hands. My 17-month-old daughter had HFMD just 15 days back and now she's absolutely fine. Actually, I had been to the hospital for my child's routine checkup and I had allowed her to play with the toys out there, which I usually don't. And I think that was the biggest mistake I made. The very next day, she started getting red boils just on her arms and feet along with fever. Without wasting any time, I rushed her to the hospital. The pediatrician made me understand that it was a very common illness and I shouldn't be worried. The doctor prescribed Febrix Plus DSLR 3 ml thrice a day to treat her sore throat and fever and a lotion named Atarax to soothe the itchiness. Under the doctor's guidelines, as a parent, here are a few things that you too could do to help your child recover soon. The very first thing you could do is isolate your child. Keep your child indoors for a week. Isolate your kid from siblings as you might not want two sick kids at the same time. I had to send my toddler to the grandparents for a while. So my next advice would be make your child wear comfortable cotton clothing. You can give your child lukewarm water bath, adding a cup of neem juice. This would give your baby relief from the itchiness. Avoid warm food. We Indian parents love to feed garma garam khana to our kids. But in a condition like this, allow the food to cool down so that the child would be able to swallow with ease. You can even give popsicle and some ice cream to soothe the bodies. Avoid food items that produce heat. Strictly avoid meat, eggs, dry fruits, spicy food, oily and junk food. Give plenty of fluids. Kids might have an aversion to food, which is why you can include coconut water, boiled dal and rice water. Let the child sip on water frequently. Apply the prescribed lotion or ointment generously after the bath all over the body. Apply it thrice a day. You can keep some neem leaves on the bed next to your child. This too soothes the itchiness. Give your child lots of love and support. Cuddle your child, allow your child to rest well. Make your child know that this too shall pass. Now the main question arises, how long does it take to recover from HFMD? It varies from person to person. It might take 6 to 12 days. My child took 7 days to recover. On the 6th day, her red boils dried up and started clearing. Now she still has some marks here and there, which will go away naturally. As a parent, do not stress out. Once healed, the child will be immune to the disease. In order to prevent HFMD, practice hygiene. Now, I am a mother who is so much particular about hygiene when it comes to my kids, but still my daughter got one. So at times it is inevitable. So don't stress out and remember, this too shall pass. If you found this video helpful, do subscribe right away. And if you wish to add any suggestions, please feel free to drop a comment. Do like, subscribe, share, hit the bell icon. Thank you. Take care.